Welcome to this podcast of the Elements. With our Body and Mind Vitality program, we want to inspire people and give insight what you can do yourself to improve your health and your vitality. And today we will talk about back pain. Millions of people every day experience back pain. So the question is, what can you do yourself to prevent or at least lower the effect of back pain? And today we are going to talk about that with our guest, Christel Lemmen of Body Minded. Welcome, Christel. It's great that you are here. I know that you really look from a holistic view to back pain, so all factors that have influence on the back pain that people experience. It's a very interesting view. Can you please tell me a bit more, and the audience of course, about your background and how you have developed all this knowledge to help people with back pain?
Well, thank you, Nico, for having me. My background my focus started at 4 years old, thinking I want to be a teacher of physical education, and I told my parents, so it was very clear that that was what I was going to do, and I did. And also I told them, and I want to be a physiotherapist, so all done. And I definitely worked for years as a physiotherapist, but also I became, in Australia, an exercise scientist, studied there and lived there for 20 years. So you could say that I'm very intrigued by health and movement. And because 90% of all of us will come across back pain once in our lives or some more often, it's something that I saw quite a lot in my practice. And if you look at commonly, people come in with the misconception that, it runs in the family, so I will have it as well. Well, surprise, 90% of people will have back pain, so you're more an exception to the rule if you don't have had it in your life, or you might not have had it but will get it. So maybe this can help as prevention at the same time as that looking at cures. And when I was working as a physiotherapist, you have protocols that you have to follow because they are completely researched. What would happen with muscles, with bones, with ligaments. But it turns out that that's just part of the full picture. And I think it has to do with the time that scans came up. So imaging will show you a bright picture of this is going on. That's what they thought. And still a lot of people you might at home have had a scan or have asked for a scan because you had back problems and thought, that will tell me what is going on. But it turns out that you rarely need a scan, only when there is, in language that we use, a red flag, where there's something serious suspected like cancer, or when muscle tissue doesn't work anymore. So it's a full nerve blockage for one or another reason. And obviously there's a few other medical things that you might refer to have a scan done. But I think the enthusiasm with scanning became because it was possible to do imaging. Only it turns out that the same amount of people that have no back pain as the people that have back pain will come out with the same imaging. So there's no correlation between what your results are from a scan with the pain you have per se. Mm-hmm. And that's an important thing to understand. And for me as well, that became an important thing, that image, even though it says degeneration or facet problems or whatever, it's a biomechanical explanation. That doesn't mean that that's the cause of the back problem. And that's where I started looking broader, and luckily physiotherapy has broadened a little bit. But for example, talking about emotions and stress, talking about organs and stress, is in the protocol of the Western physiotherapy not done. And that's where I missed sometimes the link. Why does someone not heal while I follow the protocol? And living in Australia, there's lots of Chinese medicine. In yoga, you talk about organs and emotions. And for me, apart from looking at nutrition, at sleep, at stress, it made the picture quite more complete and easier to help people with back problems.
Well, thank you for explaining that. I think that is a very important insight. On your website, I see that you did a lot of studies, both in the Netherlands and in Australia. So I could say you are really scientifically schooled, but at the same time, you look at this holistic view.
Yes.
I saw also on your website that you say really, or true health comes from within.
Yes.
So what do you mean by that?
That your health problems might give you a cue what at least the body thinks, well, this is not working for me. And that is much broader than only mechanical things or only nutrition. So in my opinion, health problems can help you to change your view about yourself, about your health, about what you absorb, and not only nutrition-wise, but also emotion-wise, or people around you, the influence that other people have on you. And injuries and sickness can give you insight in, is this where I want my life to go, in the direction of how I think or how I act? Or is it time to rethink and redirect where I'm going?
Yeah, so that people become more conscious what's going on in their life.
Yes.
And also realize that there are a lot of influences on
Yes.
their back pain. It's not only that part in your body, but your organs and everything, and stress do influence it.
Yes, and if I might give an example about, if someone comes in and says, I've had back problems for a certain amount of time, and they work 70 hours a week, then mechanically you could think, well, he's sitting a lot, so that might be a stressor or a problem. But why are you working 70 hours a week? Where are your other priorities? Do you have a lot of stress that you work that much? How is it financially? Do you have enough time to eat? And what do you get out of that 70 hours that you wouldn't get anywhere else in your mind now, in your opinion? And is it time for a shift? Because who is missing out in family and friends that you're away that much? So then it becomes a real holistic picture.
Yeah. And if you look at as what can I do myself, for example, if I think about exercises, when you go to your doctor or you go to the physio, then they also come up with certain advices.
Yes.
I know that from the past when I went there myself for those things. How do you look at that, and what is your view on the exercises and what you can do yourself?
Yes, you can definitely do a lot yourself. So basically, if you're not in a lot of distress, if you are in pain but still think, okay, I can manage this pain and I'm not too worried, most back problems will relieve in 6 weeks by themselves. So yes, if you would have moved and you've lifted a lot of boxes and you have a sore back, fair enough, because that's an overload. Or if you've had a period where you have been working much because there was this project that need to finish, and that will solve itself. But if you think, something's wrong, and you go and see a specialist in that field, in the past it would have been rest. And if you really look back when people went to see the doctor, they would say have 7 days bed rest and not move. That is completely changed. So any professional hopefully will say keep on moving, and even if that means 10 minutes, go for a walk, and then have a rest. And if that rest for some people, because it's depending a bit on what's going on in the holistic way of the back problem, you might lay down or you can sit. It's individually. But at the same time, if you keep moving, that's the best thing you can do so that you don't lose muscle mass. And also, it means that movement and pain are not per se the same thing. So even if movement hurts, it doesn't mean that you do more damage. Mm-hmm. And in the past, I think everything was turned to get the pain down before you start exercising. That view has changed. Also the view of any exercise is good for back pain, not only core muscles, which still has a really good big focus in, if you look at Pilates, for example, it's very big in Australia, and it's getting bigger here in the Netherlands as well. Focusing on one specific area doesn't do more than focusing on the whole body. So I would say move regularly. If you can, make sure that you stay strong or get strong. That are the general advices if it's about the movement. And hopefully when you move enough, your stress level goes down. But I guess we will get to that a bit later.
Yeah, well, it's nice that you bring it up, because indeed it was a question. We all know that as a human being we need some stress. Stress is good, we can realize things, but if you have too much stress, there's an overload, then that can already harm our health.
Yes.
So how do you see, what is the influence of stress on back pain? How do you see that?
Yes. The influence can be in more than one way, but let's start with the nervous system. So if you are really stressed, then you might hear the clock in a room much more than when you're really relaxed, because your focus is so narrow. It means the nervous system is more alert, and it also means that it will fire quicker when it thinks that it's feeling something pain-wise. And the more you're focused on your back pain, the more alert the loop in the nervous system will be. There's back pain, there's back pain. Distraction, for example, is a good way to lower the influence of the nervous system to get less pain. And less pain usually means less stress. That's one way to look at it.
Yeah.
The other thing that can happen with stress is that your breathing changes. And breathing and back problems, we know that are really related. So on your platform there is the breath work really well explained about that you can breathe into your belly and your side ribs and your chest. And what you see that when people are really stressed, that they usually work into their chest more than that there's a relaxed belly. The more relaxed the body is, the better the muscles can function, the organs can function, and your mobility will work. And so working with breathing to influence your stress levels is related as well.
Yeah. So that's also why we have in our program those breathing workshops,
Yes.
that people learn to improve that.
Yes.
I want to come back to what you said, because I heard you say that pain also causes stress.
Yes.
And the other way around. And I know that sometimes people are in a personal circumstances because of family, work, finance, whatever. And then they have so much stress, so that influences that. But you have also the other way around, people that have a lot of pain, and because they have so much pain, they also have a lot of stress. So how can you come out of that circle?
There's obviously individual stuff that I normally would look at and that you might, when you listen to this podcast, have to think about yourself. What are my stressors? And if they are there, if they're heightened, is my pain heightened? To see if that's connected. And there's a woman popping up in my mind that I've treated that had back pain, and she would even faint at work. And she was quite young. She had a quite senior job already. And one of the first things I said is, "But how's your job? Are you enjoying it?" And she said, yes, I really enjoy it. I think within 3 or 4 weeks, she said, I had a rethink, and it's actually quite stressful. And what I've always wanted to do is study psychology. She stopped her job, enrolled in uni again, and so to say that fainting is usually a reset of the nervous system when the pain is on a scale of 0 to 10, close to 10, and she would describe it as 11, so completely anything was focused on pain, and she couldn't handle it anymore, and that's where the system then says, okay, I'll faint, and that's a reset. And she said that pain dropped, and it's now at 2. I still feel not really fit, but I started moving again. There's no pain with movement. So the pain scale can change because there is a stressor that you take out, and that will be something for you yourself to think about. Is there something obvious? Or maybe something underlying that's not mechanical, biomechanical, because in physiotherapy and in science, in the past it was promoted so much, you do this exercise and you do that for a certain period of time and your back problems will go. But yes, there is nutrition, there is organs, there is circadian rhythm, there is sleep rhythm, and there's stress that all have that influence. So if we talk about stress and say a stressor could maybe be not even like, there's an emotional stress, but there is a stress because my organs aren't happy because I'm eating fries every day.
Yeah. So how important is nutrition for me as a human being, but certainly if I suffer from back pain, how important is that?
Then the first question I would ask is if you can have regular bowel movements. So if you can go to the bathroom and number 2, as we call it, in the morning, first thing within an hour, without cigarettes or without coffee. If that is not possible, then your rhythm of when the organs work their best, and you can imagine your organs hang in a big sack and they are attached to the spine. So if something's really not working there according to the rhythm that it should have, and by the way, if your bowel's really well, you should have 2 bowel movements a day. And then individually, I will talk a little bit more about the whole poo situation, which I won't do now. But, there's all kind of things that can be asked and that you can see in the toilet that give clues about, what's going on. And that would be then something to change, because the attachments to your spine of all what's inside the belly, they can be pulling on that belly, they can signal I'm not happy and create pain.
Yeah, and what can you, because you mentioned a lot of different factors that influence our health and our back pain, what can I do myself, of course, become more conscious about what influences my back pain, but for example, are there certain exercises, or is it useful in the morning when you wake up to start with doing some exercises to start the system?
Yes.
How do you see that? What is your advice there to the people listening to this podcast?
Yes, a few things, and I might get back to that in a couple of minutes. We are so trained, even I am, to look at back problems in the protocols of physiotherapy, that it's biomechanical. So you would, if you see a doctor, have a scan done, or you might be worried and want a scan, and the results will say, you have degenerative, let's call it disease, that's the worst to get that dropped on you, or a facet joint, or a hernia, or all these imaging results that when you get those results, and I don't know when you're listening, if you've had that done and you come and see a physio or another expert in the field and say, oh yeah, but I have a hernia or I've had a hernia, that little thing in your head will then for you probably explain, this is the reason why I'm in pain. But it turns out that if we compare people with or without pain with those same imaging results, that it's 50-50. So it means, if I speak for a moment in the science language, there's no correlation between the results of your imaging and the pain. And still what happens is, okay, so if the pain is, and I'll pick not a hernia because that can be a medical red flag when there is muscles that are not working anymore, and that might lead to a different path. But the general back pain that normally releases itself in 6 weeks, there is no reason to get a scan. And even worse, with these results that you're in your head, like, oh, you know, I've got the back of a 90-year-old man and I'm 50. It means that it's not explained how to read the results, and then they work against you because it will make you worry, how do I have to live, because I want to live to 100 with that old back. So the movement is in general good. When you get older, you have to stay flexible, and definitely you have to stay strong. So movements in the morning can be as simple as, if you don't have much space, jump up and down after that you've have moved in bed a little bit, knees to the right and left, and a little bit of stretching. If you're into yoga, do 10 minutes, some sun salutes and a few poses. If you are into breathing, and on your website, you know, the breath work and yoga give good examples, do that to get the systems going. And what is a really good one for your fascia, so that means I always explain the chicken fillet membrane, that white membrane around the chicken that becomes a tendon, that should be nice and fluent and slide. And if you jump on a trampoline or on with a rope, or just dance in the morning in your room, in the living room, that will make it more fluent, and that will help you through the day, apart from getting up regularly when you have back pain. That is the mechanical part of the solution.
Besides the total holistic solution,
yes,
you have mentioned a number of things. What about your sleep, the quality of your sleep?
Yes.
Is that also of influence on your back pain?
Yes, definitely. If you look at sleep, it begins in the morning. You need daylight exposure, and even if there's no sun bright shining, the eyes will catch the brightness and will move the hormonal system to a cycle that is connected to the circadian rhythm. Circadian rhythm means that every organ has 2 hours a day. According to Chinese medicine and also Western, we know that we have fluctuations in hormones and in activity in organs. But 2 hours that will go through a cycle, and that cycle in the morning is 5 to 7 is your large intestine. And if that one is off, then it also means that during the night your system is off. You might, especially women going through menopause, they might wake up between 1 and 3 during the night. We know that from Chinese medicine, and I won't go into that now, but if you get up or if you wake up a lot, it means that your quality of sleep is not great, which will influence your nervous system again, rest and digest, and your action nervous system, sympathetic, parasympathetic balance, and they will influence again how quick you pick up if there is something triggering the nervous system, your alertness or your irritation level. not only in the nerve, like if I squeeze you, that you experience that as pain, but also that you're irritated. Someone is irritating. I hear noise next door and that irritates me. And then when you're in a really happy, non-painful period, you might not even notice that the child next door is crying.
Yeah.
So it's that complex that if the nervous system off, then you will start shifting your sleep pattern as well and your relaxation.
So how important is then your total mindset and your self-care on the recovery of your back pain?
Apart from understanding that it's more than mechanical, it could be how can I influence my stress levels, my nervous system, and then the emotional and organ part. And if you think, oh yes, that's me, my system, I feel stressed. If you are into yoga and meditation, a really nice one is starting in the morning, or if you're even more stressed in the evening and think I can't sleep, do a short meditation if it's new for you, and start with gratefulness. What's grateful in your life? And it can be as simple as it's a sunny day, or I'm thankful of friends that are around, or I'm thankful for a pet that I have. So it doesn't have to be anything big, but something small. And then the second step in a gratefulness meditation would be forgiveness. So if there is stuff that you're walking around carrying on your back, let's use the expression, of what's triggered you during life or during this period, and it really bothers you, then think about, I might have done stuff in my life that triggered someone else, and I'm only a human, and that other person as well. Even if it's done deliberately or, maybe not, try and work on, okay, I would have done maybe once in my life or twice or maybe a lot the same thing, so that you can start working on forgiveness, which will relax the system. And the third thing you can do in a small meditation to calm down the nervous system is asking for help. And help can be as simple as, if you hear something twice in a week, I better pay attention, because if two people tell me that about me, or a direction that I want to go, I better follow up on that advice. Or you might want to think about praying if you are religious. So you ask God for help, or the universe if you're not into religion. There's all kind of ways that you can try and set your mind calm, like this is the direction that I want to go, and this will create less stress and calmness.
Yeah. I really like what you say, because it's also part of our program in the meditations.
Good.
And that's also online. And that brought me to the question, because I see on your website that you also do sessions online.
Yes.
And of course, I was wondering, how do you do that with back pain? I think more about going to the physio. But now, after talking with you and listening today, I understand better. Can you say something? What can you do online to help people, to make people more aware? And what should be done really more in a personal treatment?
Yes. It started basically in, let's talk a bit about the guideline, and in physiotherapy around COVID, it was not uncommon to do telehealth. And they've done a lot of research, and it turns out that the results are as good as in person. Mm-hmm. So the exercise part and the questionnaire and trying to figure out what's going on. If you're worried about, but I'm not there, and how can she know? That's all the same. Even more, as we chatted about before, I've been lecturing at university in physiotherapy, and I don't know how many students I've learned to feel how the pelvis is moving, and I was really convinced that I'm good at it, and I could correct students. Turns out that it's not possible to have really good measurements, so I don't do that anymore. If you question, well, yeah, but the physio always feels if my back is out, because that's a really good English expression. And also on the field of manipulations, it is not the pelvis that is realigned, because the bony structure takes around 20 minutes with a scalpel in the anatomy lab to loosen up. And you manipulate basically a reset of the nervous system a little bit. And why does it feel that you have a pelvic tilt, or that the pelvis is not even? And it's got much more to do with the nervous system, with the muscle tissue that might be tight on one side, or even with neurology, and that's what I use a lot. So it could be that your eyes move in a different way, or the balance system is a little bit off, and that's all possible to test online and then give exercises. That's the mechanical or the neurological part. And then obviously the nutritional part, the stress part, the guidance of emotions connected to organs, because Chinese medicine is really good at it, and also yoga, where my education is as well, to look at what happens when you are really annoyed. Then usually that is you compensate with drinking or with drugs, or you get really pissed off.
Yeah, well, sometimes it helps.
Sometimes it helps,
yeah.
But as long as the organ releases, and in yoga we use lion's breath. I don't know if you have ever heard of the lion's breath.
No.
That's a really angry, full-on, I'm the big lion, and you stick out your tongue and you use an eye movement.
Oh, yeah.
And that is to release that emotion. So you really have to feel it and use that and spit it out.
Yeah.
That are things that you can all figure out online, and not that I let everyone do a lion's breath,
No.
but people might recognize that out of yoga.
Nice.
Yes.
Well, talking about online, also good to mention that on October 8th, you will give a free webinar.
Yes.
In our program, 8 o'clock in the evening Dutch time. If people want to register for that, they can go to the website of theelements.health. And also good to mention your website if people want to know more about all your knowledge and your passion for what you are doing. Body, Mind, Strike, ED, education.
Yes, it's a middle slash, if I say that right.
Slash.
Yes.
Yeah.
Still not, I think.
Yeah. And then .com.
Yes,
so
yes.
Body, Mind.
Yeah. And then
yes,
the slash is probably the side one. It's not the yes, yeah,
okay.
Yes.
Good to learn that.
Yes.
So is there? If you look at all the factors you have mentioned that influence it and your holistic view, if people now have listened to this podcast, is there something that you want to give to the audience? Something for advice, some practical things that they can do at home? And
yes.
I know this is a challenging question because you have taught so much.
No, I think if you have listened and thought, oh yes, that's me. Why am I working that much? Because that's not uncommon. Or, oh yeah, I hold my breath when I'm behind my computer, and that's another one, and that means that you're triggering the nervous system, because it's a fight, flight, freeze reaction, like, oh, there's a lion, be quiet, or better run away as quick as you can. But the body recognizes things by movement or by stress, and that reaction will then trigger the nervous system. So observing, what am I doing? How is my breathing rhythm? Do I breathe into my belly? Do I wake up during the night? Am I sleeping every day around the same time to get my circadian rhythm well? So if you are in weekends up late, go to bed late, try and level that out a bit more and see how you feel and how your back feels. And if movement, while movement is painful, doesn't mean that you do more damage. So sometimes it might be that you have to try, if I move more often and have then my rest, and that could be sitting, lying, depending on your problems. But if I do more, get my back problem, is that getting less? And that's quite possible. So looking a little bit further than, I'm going to do exercises, and that will solve my back problem, because that's still what you see a lot online, yoga post, the 5 back exercises that will cure your back pain. So don't believe everything, and not even with AI and the shifts that are going on within science. They sometimes go very slow, but sometimes go very quick, and you might not pick that up. So see yourself what you can figure out with the things that we've spoken about, but don't start Googling too much, because that might not be the truth either. Like, the person that says, yeah, my neighbor has as well, and he couldn't walk anymore, or he had the same results of the scan, doesn't mean anything. So make sure that you're well educated and not freak out with your results. Move, breathe, meditation, and look at your sleep rhythm, look at your stress level and what's behind it. Why are you stressed so much, and why is it important what you do, the way you do it? And then the last bit, of course, nutrition and organ, emotion, they come together as well. So maybe you just have to relax more.
Could be a good advice for many people.
Yes.
Yeah, so I think it's always important if people have really serious health problems. I always say, please go always to your doctor.
Yes.
But also look around. Is there a therapist around or online like yourself who can help you, can make you more conscious about what you can do yourself? And then the third part is, what can you do yourself? So I think the combination of those 3 things together, and every human being is unique. So yeah, there's not one treatment for all.
No.
And that's also why you can sometimes really good use the advice of a professional like yours.
Yes.
So thank you so much. I thought it was very inspiring and very insightful. I hope the audience will also like it. Looking forward to the webinar on October 8th and to learn more. And
yes.
Thank you again. It was a pleasure to have you in our podcast. Thank you, Christel.
Thank you for having me. And for the webinar, we don't stand on our heads, but make sure that you have some comfortable clothes on. It won't be intense exercise or other advices, but feel free to ask some questions, and we agreed to pick out a few main subjects. Obviously, the individual, really individual questions are much harder, because
then people should contact you.
Yeah,
but indeed a good idea to ask before if people have certain questions in common.
Yes.
We can handle some of those.
Yes.
So let's see what happens. But good that you add this, because it's important for people to know. And again, they can go to our website to register for this free webinar. So
looking forward to it.
Yeah, me too. Thank you.
Thank you very much.